Hello there, my name is Oliver, and welcome to the Ozone Medical Centre. I understand that you are here today for your annual medical/physical examination. Is this correct? Understood. Well, rest assured that you are in confident and capable hands here at the Ozone Medical Centre. Our doctors and physicians are of the highest calibre. Now, I did just have to ask a few preliminary questions before we continue with today's physical assessment, just to make sure there were no drastic changes from your previous visit 1 year ago today. So, of course, I can assume your name has not changed. Could you please provide me with your most recent address of residential living? Here we are. Yep. Excellent. And was that with EI? Yep, EI. Okay. And just the postcode for that one. I'm not familiar with that area. Understood. Okay. Excellent. And in terms of your medical history, how have you been feeling? Have you noticed a significant decline in any of your major functions, such as touch, smell, hearing, sight, balance? Do any of these have any alterations, or have you noticed any changes? I see. Okay, I will definitely keep that in mind. Now, it says here that you were also querying just a bit of a functional capacity assessment. So what that basically entails is, and I can write this down for you later, is a functional test for a few movements, such as with lifting, or for muscle strength, range of motion, or ROM, to make sure that you are functionally able to perform a certain activity or task set in front of you. Now, this may be for a job or occupation, so I understand this is something you are after for any potential jobs or whatnot that might be upcoming. Well, I can definitely sort that out. What I will begin with, however, is just undoing my sleeves, because we will be getting in close to examine a few areas, including up there with your facial muscles. So, allow me to explain today's procedure while I get these sleeves sorted. We will be doing a vital signs check involving your blood pressure, heart rate, temperature, pulse, oxygenation levels, etc. So, let's begin. Thank you. And we are right on time. We'll also be doing some auscultation with my best friend here, my stethoscope. In addition, I'll be doing some sensation testing on you, differentiating between sharp, blunt, etc. Let's begin. I just would like to test your heart rate or your pulse. So, I'm just going to be palpating or feeling in your radial artery, just in this region here. I'll Alternatively, we could use your carotid region, or better yet, use a pulse oximeter device, but unfortunately mine has been misplaced. So if you could just please lend an arm or a hand for me. That's it. Thank you. I'll just have a feel there and count manually with my watch. And don't be afraid, there is nothing to be afraid of. Throughout today's assessment, we won't be using any invasive or painful techniques. I assure you, today will be fine in terms of things that will make you nervous. If at any point you feel... That's it. Excellent. Yes, if at any point you feel tired or you feel anxious or anything out of the ordinary, please let me know. Don't hesitate to tell me and we can adjust accordingly. So I'm just getting my watch here. So right now taking... Excellent. Timesing that by 4. Okay, perfect. So your heart rate. Excellent. Thank you for that. Let's just check your temperature now. I have one of these little guns that will just put that in front of your forehead there. And excellent. That one is all clear as well. No dramas. Moving on, let's check your blood pressure. I have with me what is known as a sphygmomanometer. Now, just so you know, you're probably familiar with these before, but these types of devices where we will use a pump, a cuff, and a gauge to manually check your blood pressure, your systolic and your diastolic blood pressure. So, if allow me, do you have a dominant arm? Okay. If that's the case, we'll use your arm there. Just please have your arm outstretched, relaxed nicely on the table right next to you, with your palm facing up towards the ceiling, please. That's right, in a supinated position, we call this. A supinated position of the forearm. I'll just prepare this cuff. Now hang tight, there's nothing to worry about. Fantastic. Now, we'll just apply this cuff around your upper arm there, in your bicipital region. That's the way. Now, do not fret. This may feel a little bit tight. That is fine. That is just the gauge and the pump working as intended. We'll be using these devices. In addition, I'll just be using my stethoscope here to be able to listen for your pulse. Now, please just sit nicely, relax as best you can. You're doing fantastically, by the way. Now, I'll just have this one. Now, relaxing please as best you can. How are you feeling? Perfect. Keep up the good work. I'm just going to tighten this one up. Excellent. And just releasing that valve. Excellent. Now, that wasn't so bad, was it? I'm just going to take another reading. This should take not long at all. Hang tight. You're doing very well. Here we go. Just going one more time, just to make sure that I got an accurate reading. So. Pumping this one up all the way until I cannot hear your pulse anymore. And then we will slowly release some air in this valve, and I'm listening for your pulse to start back up again. Excellent. And there we go, we have your systolic and your diastolic blood pressures there. Well, you will be pleased to know that everything is in order. I'll just jot down these results and compare them to last year's. Your vital signs, at least from right now, seem in order. However, I would just like to compare them to your visit from last year. Now, good news, our vital signs all appear to be fine and within normal limits, W and L, at least compared to last year's results as well. So, something to smile about. Anyway, so blood pressure, check. Pulse / O2, check. Temperature, check. And your respiratory rate, all in order as well. So, let's move on. I'd now like to do a quick auscultation, listening to your breathing with my stethoscope. Now, I'm just going to apply the stethoscope on your skin. Now I'll just try and warm it up for you. It can be a bit cold, especially this time of year. So please keep in mind that this will be okay. Now, if you could please take a nice deep breath in through the mouth and out through the mouth. Inhale. Inhale. Exhale. Well done. Inhale. Exhale. Perfect. Now just on the near your rib cage there. Perfect. How are you feeling? Excellent. Okay, we've covered most of the major areas on the front there, frontal area. Let's just continue on the front there, please. In through the mouth. Excellent. In and exhale. Perfect. Now, if I could just get you to turn around, I'm going to be placing these ones also on your back region. Same thing. Please take deep breaths in and out through your mouth. You're doing well. Let me know if you need a break or you're feeling discomfort. Let's continue. Excellent. Just reaching in there. Okay. Well done. Very happy so far with your breath sounds. Wonderful. Absolutely wonderful. No abnormalities there. You're getting a nice, good expansion into the bibasal parts of your lungs, or the bottom parts of your lungs. So, the basal areas rather, but you're getting it bibasally, so both sides. That is excellent. I'm not hearing any crackles, any wheezing, any abnormalities essentially. So, respiration-wise is good. Happy with your breath as well. So, let's move on. I did just have to do a few measurements here. So, just measuring I know last time you flagged that your neck may have been feeling a bit sore, so I just want to go in with my trusty measuring tape and measure your neck movements side to side, just so we can compare them to last year's in my little journal here. Okay, let's start with bringing your chin towards your chest, looking straight down. That's it. Just measuring your chin to chest there, and that is excellent. All within those normal ranges. Now, let's do the opposite. Moving your head up towards the ceiling, like so. Excellent. Just up. If you could do so, please. Try not to get blinded by the lights. It can be quite confronting otherwise, but perfect. And how do those two movements feel so far? You're not in any pain, discomfort, agony? Okay, very good. Let's continue moving across to your other side now, just towards that direction, looking over your shoulder. That's the way, just measuring from your chin. Perfect, just coming in this side, your chin area, over to your AC joint. There we go. Excellent. And then if you could just repeat that feat, looking over towards the other side, please. We'll just have a measurement on that side as well, moving from your chin towards your AC joint or your acromioclavicular joint now. Your AC joint sitting on top near your shoulder, right through there, that little bony part up top there. So, excellent. Yeah, well done. That feels fine as well. Perfect. We did just have one more movement in our cervical spine or our neck, and that was just our lateral flexion or our side flexion. Essentially, if I could get you to please move from ear to shoulder like so, and we will go both directions. Please ensure that you keep your shoulders shrugged down. I don't want you to hike up like so and cheat. No cheating here. So let's go with that side for me, please. Excellent. As far as you can. You may feel a stretch on the opposite or contralateral side here of your neck. So let's just measure that one from your ear towards your AC joint as well for consistency. Excellent. And then your other side for me, please. Well done. Again, you may or may not feel a bit of tightness in through your opposite side of your neck, potentially through your scalenes or your levator scapulae in that area, but no tightness in that area. That feels fine. Same when you went to the other side. Okay, well, all of those movements from memory, I'll just compare them to your results from last year. But yes, all our neck movements were full pain-free, except for the lateral flexion, which was a bit tight, but that seems to have improved and excellent. I see you may have been performing your stretches more often, which is always good to see. So, yes, it pays dividends to follow along the advice of your health professionals. Anyway, let's move on. I did have a quick sensation test for you. I will be employing the use of my little cotton bud here. Now, if you could please just differentiate between this light touch onto your cheek. Just let me know if you can feel it. I will ask you to have your eyes shut for this one, and I'll just be, again, lightly scraping it onto your areas of the face and neck region. Now, let's continue. You could just shut your eyes for me. No cheating. No cheating. Now, can you feel this? And this? How about that? Now, here. And does this feel the same as this? And does this feel the same as this? Excellent. How about here versus here? Do they feel 100% sensation-wise? This compared to this. One more time. This compared to this. Wonderful. Just feeling, tracing up along there, just making sure our sensations are intact and well and truly able to be felt. Wonderful. Now, that's good. I'll just put this one in my little kidney dish. Now, you can open your eyes there for me now. Let's just do a quick check with your eyes. I'd like you to please look at my nose for me, please, and I'll just be observing for any abnormalities. We're getting it quite close here. If you could please keep looking at my nose. Excellent. Okay, now staring at my finger, maintaining contact, eye contact that is, with my finger. Excellent. Just looking in those regions. Fantastic, fantastic. That is looking very good indeed. No nystagmus, no. Excellent. Very happy with how you are performing with your eyes there. Okay. Well done. Yes. And when was the last time you had an optometrist review or an eye review? By a specialist, essentially. I see. Okay, well, moving on. I'd like you to perform a few coordination tests now as part of your requested functional capacity assessment. If you could please now gently touch your nose and then out to my finger. And I'll get you to touch your nose and then out to my finger, back to your nose, then out to my finger until I say stop. Let's commence with your right hand now. On your nose and then out to my finger, back to your nose and then back to touch my finger. Now switching hands, could you please use your left hand with your finger on your nose, moving out now to touch my finger. Once more. Excellent, yes, lean forward if you have to. And then once more on that side. Okay. Well done. Happy with that. Mainly we're looking for any overshooting or poor accuracy and precision, but that was all fine. So, double thumbs up from Dr. Oliver. Let's continue. I did know I mentioned about the functional capacity assessment, and as part of that, I need to make sure you have full range of motion across all of your joints. Now let's just start with your upper body. So I've already seen your neck with your shoulders. Just please lift them gently up above your head, getting that elevation of our shoulder. And then down. And then please, going out to the side like a chicken wing, as high as you can. Excellent. And then with your elbows tucked in to your body, moving them out towards the side. Perfect. And then back in towards the body. Well done. Now I'm just going to get you to perform those movements one more time, and I will be resisting that. So let's start with our elevation up towards the ceiling. Just applying some resistance there, or manual muscle testing there. And then trying out towards the side. Let's do our chicken wing, like so. Bit of the chicken dance. Just be feeling. Yes, good for our deltoids there. Middle fibers of our delts, as well as our supraspinatus, and a bit of a rotator cuff going on there, so that's good. Now, let's try with our elbows tucked in, moving them out and in. Perfect. Just against my resistance. Excellent. And then coming in towards the body as though you are hugging yourself. Go for it. Moving in towards the body. Very well done. Next, let's just do some marching on the spot, making sure that even weight transfer and those knees are going up nice and high, nice and high, 90 degrees plus for me, please. Excellent. Now, just to get you to stand on one foot for me, please. Doesn't matter which one, we are going to do both. So standing on one foot, please. Excellent. Let's time this one for about 10 seconds. Eyes open. 10 seconds starts now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Excellent. And then your other foot for me, please. Just a quick balance check. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Well done, and you can relax there. I'm very happy with how you've performed today. I think that will conclude today's examination, and as far as I can tell, there are no abnormalities that should warrant any further investigation. Yes, based on last year's results, comparing them to now, I see no reason to be alarmed, as was originally thought at the start of today's examination. So I'll just do that up in a report, especially for your functional capacity side of things. That was a bit of a brief one, but I think it's what you were requesting. So I'll just jot that down in my diary to complete your functional capacity assessment report. Excellent. But I'll just sign off on that, and it should be emailed to you. I'll get my admin team to send that through to you in the next 48 hours. You can expect that one. So thank you very much for coming in, and if you have a chat to the admin staff, I'm sure they can book you in for this time next year for your next annual physical examination. Thank you for coming in. If you enjoyed this video, please click like down below. Let me know your thoughts in the comments, you amazing people. And click subscribe if you enjoyed this video. And to be notified, hit the notification bell for further videos. Thank you very much, and have a wonderful day. Thank you to my awesome Patreons: Megan, Electra, Amado L, Joaquin, Gabriel, Patrick, Troy, Keith, Andres Olan Vasquez, Stephen Underwood, Anthony Espinoza, Kayla Rajanen, Blaine Bettinger, David Emanuelson, Kenneth Clary, Melanie Gardner, Beth Burton, Josh Santana, Fading Muses, Here's Mikey, Kylie Denton, JJJ, Hannah Rose, Alex E, Stephen Joyce, Abby Lynn, James Peacock, Jessica Montez, Curious Madcat, Stephanie Hood,